Our next panel for today is a discussion about disability and health-related supports. So once again, there's so much that we could really talk about here, including costs for therapy, medical equipment, medical supplies, how child health outcomes are impacted when costs are a barrier to meeting healthcare needs, what role accessible homes and vehicles play in the social, emotional, physical, and financial health of the whole family. Ultimately, we're looking at where childhood disability and the lack of supports and that poverty piece that keeps coming up again and again, these financial challenges are affecting health outcomes. Today, we are fortunate to have with us Jennifer Baumbusch, who is a professor at the School of Nursing at the University of British Columbia. She is conducting research about the impact of public health measures on families and children with medical complexity, among myriad other things that she is researching and working with. And we have Dr. Olaf Kraus de Camargo, who is an associate professor at the Department of Pediatrics at McMaster University. He is co-director of the CanChild Center for Childhood Disability Research and a member of MacArt, which is the McMaster Autism Research Team. He practices as a developmental pediatrician in Hamilton, Ontario. A reminder, our moderator, Brenda Lenehan, is a mom with a young son of health complexities. She is the co-founder of BC Complex Kids Society and was appointed to the National Advisory Council on Early Learning and Childcare and the Minister's Advisory Council for Children and Youth with Support Needs in BC. Brenda, over to you.
Thank you, Amanda, and welcome, Jennifer and Olaf. Very happy to have you both here today. I'm just going to let you both set the tone and get us started. There is a huge umbrella discussion here, and it could go many ways, and let's see where it goes. We'll start with you, Dr. Olaf.
Oh, I thought ladies first. Sorry.
Oh, sorry.
But I'm fine to start, and then if I can continue. Yeah, so my name is Olaf, and first of all, congratulations to this conference. It is really an amazing event, and I'm really moved, and it is I think I never experienced an event like that or a conference like that. So congratulations, you really achieved a major thing here. So that's awesome. A bit to my background. So as you might hear, I have a German accent. So I was born in Germany, and I have a strange last name that is because I grew up in Brazil, and I studied medicine in Brazil and experienced different types of poverties there as a physician, seeing patients I studied in a public university, and these students there and the residents mainly take care of people that cannot afford private healthcare, which is also existing there. And that leads me a bit to the things that I want to bring up, that comparison between public healthcare and private healthcare. So I had a good example there of these two tiers in the society and the tensions that it creates and the inequity it creates. And then I moved back to Germany and practiced for over 17 years in Germany in different places where there is a public healthcare system and a system of child developmental centers, which are called social pediatric centers in Germany. There are over 200 across the country, each of them with several physicians and specialists and therapists that provide care for children with disabilities. So that is, I would say, the Cadillac of services. And now I'm here in Canada for about 15 years. And in these 15 years, I have witnessed really a decay of services and expanding wait times for our patients. So for me to see a new patient, there's a wait list of 2 years. So you imagine if a child first starts presenting with any concerns about their development, they are usually around the age of 2 years, and then they are 4 before I can see them. And these 2 years are lost in what was mentioned in the previous panel for activities in early intervention and so on. What we noticed in the in the last couple of years with the pandemic was also and that's just my clinical observation. Maybe Jennifer has some more scientific data about that, but what I observe in the patients that I see is that there's a great disparity about how families could actually deal with that situation. So some families with financial means ended up buying several computers and tablets and were able to stay home and teach their kids. And I have children that actually did much better during the pandemic school-wise than it was before. And parents were questioning, well, he was so many years in school, never learned to read. And now he comes back and he's reading because we just were on him and we worked with him every day. And that's something he achieved in the pandemic and probably wouldn't have achieved if he just went to school. So it shows also the lack of supports that were already existing before the pandemic. And then there are families that completely broke down, and children with significant behavioral issues, not being able to get out and not getting any relief for the families. The issue of paid leave when children are sick or parents are sick is a significant issue, and we can maybe comment later on the different options that are in that regard. And I feel that a conference like what you're organizing, and we had the discussion in the preparation when we talked on Zoom, I think it is really important to come together as a country and as a group of people with a variety of conditions and disabilities and situations to really start asking for or fighting for supports that are necessary for everyone. And they will be, and we all might end up disabled at a certain point in our life and need these supports. Let's just think about the aging of the society and who will take care of all these elderly people. And so any system that we put in place will benefit everyone in Canada, not just a small group. And it's not such a small group, about 20% of the population that have any type of disability. So I think that conference or this conference here is a first step in that direction. But I'm also aware that it has been a topic that has been discussed over many, many years. And but maybe there is a critical mass now that can move things forward. So I'm hopeful for that. Thank you.
Thank you. Yes, hopefully we can move the dial. Actually, the next panel, we will have a group who's been advocating and will speak a bit about the National Disability Insurance Scheme in Australia, looking at those kind of options. So it'll be interesting to hear and look at that. Jennifer, I should have started with you. Sorry. Go ahead.
That's okay. I was very happy to go second.
Okay.
And pleased to be on this panel with Dr. Olaf. And I'd also like to thank you, Brenda. And I know that on top of all the other hats you wear, organizing a conference of this magnitude is something that oftentimes people have a full-time staff to help with. So I just want to thank you so much. I know this probably took up a lot of your spoons, and hopefully tomorrow and the next little bit, you will have time to rest and recuperate. So I will just introduce myself and the kinds of work that I'm doing. I came to this world as someone who hadn't really thought a lot about disability until I had my daughter 20 years ago. And she has an ultra rare genetic difference. So we were really thrown into a new kind of world that we didn't know about. And also we were very alone because she had an ultra rare difference. And what her doctors would say is, we're learning from her. And so we can't really tell you what the future will be. So we've spent the last 20 years navigating all the different systems and services, and certainly have a lot of that from a personal experience. And so as I was getting my PhD and starting to be a faculty member at UBC, I also realized that even though we're alone in a diagnosis, we share experiences with many other families, and our experiences are very consistent and similar. And so I started to do research about families of children with disabilities, and most particularly children with medical complexity, because that's our family's experience. And so these are children who spend a lot of time in hospital, have lots of specialists they need to see. They need a lot of assistance in their daily life, and are probably, on the continuum of people with disabilities at that area where they're needing the most assistance and are most attached to services. And so I was doing this research before COVID happened, and then during the pandemic was fortunate to get some funding to continue to do it. And because there aren't a lot of us, children with medical complexity comprise about 1% of the pediatric population. We're doing a longitudinal qualitative study. So that means that we're interviewing families and also getting them to complete diaries about what their daily life is like. And they do that about once a month. And so I wanted to bring in some of the research we've been doing, because we have been also trying to capture some of those costs that families experience that a lot of people really don't think a lot about if they don't have a child with disabilities. And I think Dr. Olaf has already touched on a few, like even the inequities among families in terms of having access to the internet, having tablets, having computers, and all of that kind of technology. So we also see the added layer of the impact on families that live in rural and remote areas. And I'll talk about that a little bit more in a bit, but to close off my introduction so we can get into the discussion, I just wanted to share one of the diary entries, a piece of a diary entry from one of the participants in our study. And so I'm going to read it out. And this is the mom of a teenage girl with medical complexity. And she wrote in her first diary entry, and this was a opportunity to write about whatever they wanted. There was no sort of guidelines. It was just about how you're feeling, what's really impacting you right now at this point in time. And she wrote, "Parents are expected to completely meet the day-to-day care needs of their child. Where many parents of children with intense care needs, this prevents the parents from being able to work in any paid employment. The inability for a parent to work creates poverty or financial hardship for most families, and this has serious long-term effects on families' financial health and the ability for family to be in any financial position to help their medically complex children later in life. I have been unable to work for over a decade now, first being the primary caregiver for a palliative ill daughter, and in the last 2 years, needing to be the manager of her 24/7 care team, working more than 40 hours per week unpaid. I remain on call for my daughter's needs 24/7 with no relief. The amount of money that we currently spend, including the high amounts to meet our daughter's care and therapy needs, is higher than what my husband earns. And this is creating short-term hardship and significant long-term impacts." So I will leave it at that and turn it back to you, Brenda, so that we can have a discussion on these issues.
Thank you, Jennifer. Yeah, and I mean, the hard thing for people to understand is that you shared is in our demographic is a common story. It's always a little different, but it is the financial hardship, the instability, the poverty, and for some deep poverty is unavoidable in so many ways. It's the financial costs are high, and the barriers to employment are also very, very high. So I'm going to just share a question in to stimulate some more discussion, but the question is whether you could share some examples from either your clinical experience, Dr. Olaf, or lived experience and research on the day-to-day large and small out-of-pocket expenses that you're seeing that have an impact on health outcomes. And I'll let whoever would like to jump in. Olaf, you're muted there.
Sorry. I think there are two aspects to it. One is the expense itself, and we mentioned, I think Khadija mentioned that before, that she has to pay 25% of the wheelchair, and depending on the wheelchair, that a wheelchair can cost more than a car. Yeah. So it's a significant amount of money. But what adds on to that is often the slowness in getting the assistive devices approved, get them delivered, get them adapted. So and that time where you do not have example wheelchair is time you lack opportunities to do other things. So this child cannot participate. That family cannot go out to do things that they want to do together. And that these are all aspects that come on top of just the money part. So I think we need to discuss not only the amount of money that it costs when you have a child with a disability, and I just tweeted out an article that I found, but it's from 2012. And in today's numbers, it would be about $40,000 a year over the lifetime of a person with a disability of extra costs from the regular living cost. That is one thing, but the other is, and that's what I heard also from the other parents before, there are so many different silos that determine things, and who pays what, and when does it get paid, and when does it get delivered. I think these are the major, and these are issues that can be solved without spending more money. These are administrative issues that don't cost anything. They are actually costing a lot of money now, usually the money of the family, because they cannot access things and they end up paying out of pocket. But there are a lot of things that people are entitled to have, but it's very difficult for them to get them. And I think that might be a first step, really, to organize systems in a different way so that this can be improved.
Yeah, absolutely. And all of that time, families are part of that. So they have to take the time to fill out the forms, work with the therapy team, go to the appointments, follow up to see what's happening, why they haven't got it yet, and apply for charity for the remainder if they can't afford it. And that time is also a barrier to employment. And it's a barrier to parenting, to just being able to be with your children. It's so true. Jennifer, do you want to speak into that?
Yeah, I agree with everything that Olaf shared. In our study, we are collecting information about the monthly out-of-pocket expenses for families. And I think, these are all things, and I'll share some of them, but just keep in mind, these are all things that families with non-disabled children are able to typically spend on leisure activities, holidays, and we aren't even necessarily getting into how inaccessible all of that is. But these are things that people are paying for. And I think in Canada, what I find oftentimes is that people are shocked. People who aren't as involved with healthcare are really shocked about what you pay out of pocket. There's this idea that with a universal healthcare system, everything is covered, and that's in fact not true. And that in some cases nothing is covered, or it's a partial payment on the part of the family. So the kinds of things that families have shared with us that they're paying for out of pocket are dental care, up to $150 a month, prescribed medications up to $200 a month, over-the-counter medications around $40 a month, medical equipment up to $700 a month, therapies up to $300 a month, and then other things people have been paying up to $1,200 a month for. And I think that a really huge thing that impacts a lot of families as their child grows are renovations to make their homes accessible. When our kids are little, it's easier to pick them up and move them around, but as they get bigger, they tend to need more supports. And so with our family, that situation really hit in 2013 when my daughter wasn't able to do stairs or walk very much anymore. And we needed to put a platform lift on our home, and found out that none of that is covered. And in order to be able to make our home even minimally accessible for her, the cost was about $20,000. And then we get into the whole issue of accessible vehicles, which new cost about $80,000. So the other thing that happens to families is their world gets smaller and smaller. You can either get into your house or you can't get into your house, or you have to leave your community because you have to find accessible housing. You can't go very many places because maybe you're reliant on public transit. And so because you cannot come up with that amount that you need for an accessible vehicle. And so these are all huge costs that I think a lot of people don't really give a lot of thought to, but are core to the healthcare and well-being of these families. The other thing that we learn from families, and one of the great things about research during COVID is instead of going to people's homes, we're doing it on Zoom. And I think a benefit of that is we have families from the Yukon participating. that wouldn't have really necessarily occurred to us before around how to recruit them. But for those families that live far away from our very centralized pediatric expertise, like if you live in British Columbia, you're going to Children's Hospital, that can mean multiple trips per year. Not all of those costs are not borne by the families. Some families have moved to rural areas because of a lower cost of living, and then they end up having to pay anyways to come and access healthcare, coming for multiple appointments because there's no care coordination or navigation. And one of the families really talked about how important it was to them that during the pandemic, for the very first time, one of the highly specialized teams traveled to northern BC. And she said it was life-changing because that meant that 4 times a year, I didn't have to pack up my family and travel to Vancouver for a brief appointment. It meant they came to us, and everybody who lives in our community was able to come to the city in that area and be able to see that team. And fortunately, that's been something that's been carried on now that we are at a different place in the pandemic. I won't say it's over, as some people like to say. We're in a different place. Our families are certainly still dealing a lot with that place, keeping our children safe and healthy as much as we can. So I think that sometimes it's challenging the myths that people who are not part of this universe have around what is costing us and why, you know, we are sinking every day further into debt or poverty because these costs are endless.
They certainly.
Maybe just to add from what you mentioned now, remind me when a colleague of mine asked me last week, oh, I saw you were on the panel for this conference, and what do you think? What can we actually do? She's a social worker, I think. What can we actually do to help them? And I said, well, first thing, maybe stop charging parking fees for the people that come to our hospital. It's $20 to park, and then they have maybe half an hour consult. And so many parents were so happy that they could consult via Zoom now. And our colleague Peter Rosenbaum, he co-authored, I think, an article that says, let's not get back to normal, like to the times before. Let's use what we learned during the pandemic and what reduced barriers for families and keep these things because they are so important.
Exactly. Like the parking was one that during the pandemic, there was no charge for parking at BC Children's Hospital, and that has resumed. But the thing that also, when you first mentioned that specific thing to me, is that then parents are choosing virtual care, which of course is good and convenient, but we don't want parents to choose virtual care all the time
exactly.
if it means they're not coming in to see you because of the cost of parking. That's a problem. Yeah,
I mentioned, I make the comparison, the different casinos here in Ontario are regulated by the provincial government. You don't pay parking for visiting a casino, so you could charge there and make parking in hospitals free.
There we go. Solutions. And yes, indeed, like the piece, I live remotely here actually, and the virtual care has also you know, if you balance the virtual with in person, it reduces, we do have a lot of our travel costs paid for in BC, but we have to take time off of our work to travel, which is a reason that many of us can't work jobs. So if we can do more virtual appointments, it allows us to also stay in our communities more. And those outreach teams, as Jennifer was mentioning, those are also beneficial for the same reasons. Did anyone want to bring anything else into this piece of the discussion?
I think I'll just add to one of the other aspects of care that it's kind of raised its head here in BC a little bit over the last few weeks is around allied health therapies. And again, I think a lot of people are under the impression that physio and occupational therapy and speech therapy are things that are covered under our healthcare system and not realizing that they're not. And I'll add psychologists to that because we know mental health is so key in our families, and many of our families would benefit from accessing psychologists. And so in British Columbia, and Brenda knows this, our government recently increased the amount of their copay for therapists. And what happened there was that some providers have decided then to increase their fees for service. And so the net costs that families are experiencing from those aren't changing. And, I do advocate therapists should be paid for their time, as, I'm not suggesting we should be underpaying therapists, but in thinking through that policy change, obviously there was no one at the table to say, hey, what happens if the therapists then increase their fees? The families are still going to be paying the same amount for their copay. Yeah. And a lot of these programs that are set up to support our families include a copay component. And so in British Columbia, for example, with our respite care while my daughter was growing up, there was a copay component for families. And, even sometimes the biases that providers and different people in the world have about families of children with disabilities, when I would raise this as an issue, they would, the answer would really be, you should be grateful for this program and families should pay a bit so you know that it's worthwhile. And it's just shocking to think like some of those attitudes are so ingrained that, yeah, you should be paying extra because you have a child with disabilities. And the ableism that is just so prevalent across all parts of our society that really needs to be addressed. But I think particularly as policy changes are coming into play, to be able to have people with lived experience present to say, but what if? Because we know all those things are going to happen, but maybe they're not being thought through by the people who are making the changes who don't share our experiences.
Absolutely.
I think you're being very benevolent. I think they are thought through and they know very well how a market works.
Yeah.
It's not a surprise.
Actually, to share a little piece of that too, it goes back to what you said, Dr. Olaf, about private versus public. So a piece of that, from what I've seen anecdotally, a lot of the providers did increase their rates when that happened. A lot of them needed to. Their costs have risen, but they kept the cost so that it was still going to be paid by government, and the parent wouldn't have to pay out of pocket. But the one provider who seems to have done something very unethical is a big private company that is been given a contract here as well. They do direct funding for parents, but also a private contract. And I think we have to be really careful of that when we look at building new systems, what it looks like to let those, it's not just private providers are one thing. For profit is where the problem comes in. It's for profit healthcare. That's what's starting to happen. And I think we should be mindful of that in the system. Absolutely.
Sorry, Brenda, I would just jump in to add, I think that people also who think the only consequence of these situations is poverty or financial issues. There's a study that came out in the last week from the US that showed that even among a group of mothers of children with disabilities, it was those who were living in poverty who had worse mental health outcomes. So as we push families further into poverty, we're seeing those worsening mental health outcomes for them as well. So this isn't something that just impacts your bank account. It's something that impacts your whole person. And so finding ways to support families so that they're not getting deeper and deeper into debt and poverty over time is something that we really need to be addressing. Hence this conference you put together for us.
Absolutely. Yeah. There's so many layers to it. I wanted to ask, sort of to get close. Where are we at time-wise there? Sorry. I wanted to ask what you see as the broader societal and systemic changes, you just spoke to one there, Jennifer, that need to happen provincially or federally to ensure all children and families have equitable health support. Do you see a path forward, or do you see other jurisdictions that we should look to? Whoever wants to jump in.
I guess I'll just jump in with a couple of the things. I think that during the pandemic, the Canadian caregiver benefit was introduced for people who became caregivers during the pandemic, and then they would receive a monthly payment similar to CERB. And what a lot of our families experienced was that they were already in that situation, and so they didn't qualify for that program. So I think programs like getting a tax refund is not necessarily what's helping families, but having money in their bank account that they can actually freely use, that doesn't have a bunch of constraints on it, as our systems currently are, I think is one key thing that we need to introduce. The other study that I want to talk about that came out recently and is being shared among families and providers is from Colorado, where with direct funded home care, they were able to hire parents as their child's home health care aide and do a comparison between the outcomes for parents and the outcomes when you hired someone who is not part of your family. Now, when I started doing caregiving research 20 years ago, we couldn't even talk about that because people said, how dare you suggest that family members be paid or that we are compelling them to do this unpaid work. But I think that things are really shifting. During the pandemic, we saw huge impacts on the workforce. Families simply can't find people to hire. And the Canadian Caregiving Association just came out with a report this past week, and it showed that in British Columbia alone, unpaid caregivers are supplementing our system for about $8 billion a year. So what we've seen is the system take advantage of that kind of idea that we shouldn't be directly paying people. What we saw from families was that during COVID, as we had more flexibility on how to spend things like respite dollars, people were like gaining the kinds of supports that they needed, and it became much more family-centered. So when we talk about family-centered supports, that financial flexibility also helped with that. So I think these are the things that we need to be thinking about. They exist in pockets, but if we listen to families, they need more money, then they need more flexibility in how they spend that money. And we need to have a little bit more trust that families know what to do and what's best for their situation. So I guess that would be where I would see we really need to change those systems and structures to begin to address this issue. And I'll pop the information about that study in Colorado into the chat in case anyone wants to take a look.
Thanks, Jennifer. Yeah, it's been really great to see that research come to light. And there's a movement happening in the US around that family caregiver pay for other states. And there's a movement in Canada starting as well around caregivers and care supports. Yeah, would you like to share into that at all, Dr. Olaf?
Yeah, I think first of all, the caregiving aspect, what I continue linked to what happens in Germany, and there's in general now a discussion in society that and that society is getting older and more people getting into pension age, and then there are mothers, including my own, that never worked, and then if their partner dies, their pension suddenly is reduced because they didn't pay into a pension, but they raised 3 kids and they supported a grandchild with a disability and so on, and nothing of that is counted. So there is a discussion that care work needs to be counted as work. It is work, and it needs to be recognized as such. So that is one aspect. The other was about paid leave, and that's what we saw also during COVID. And I can also share a study. There's a huge variety around the world how paid leave is managed. And we had this discussion recently with our own fellows who are specializing in developmental pediatrics. And the supervisor of the fellows asked, oh, how should we manage if they are sick, and how long can they stay away? And I said, well, if we are focusing on the well-being of children and their development, we should lead by example. Let's have a look what other countries do. And again, there are countries who give a paid leave for over a month of time in the year, or give a paid leave for every child that is ill during the time. Or if it's a single parent, then they get double the paid leave because they are taking care alone and they cannot spread it with 2 parents and so on. So I think these are all important aspects that need to be included. And I saw on the graph that Kelly is doing, putting it that's a medical need, and I would suggest that we not focus on one sector, because these are needs that go across sectors. We talked a lot about education, we talked about welfare, we talked about health. And the danger that I see is every time that we address something towards one ministry or one silo, that also allows an exclusion discussion. Okay, you don't qualify because this is just a social situation that you're going through. That's not due to the cerebral palsy of your child, or that's not due to autism. That's due to where you're living, or you're just living far away. That's your problem. You have to pay for that travel. No, it is not that. Like that, accessibility needs to be available for everyone. And I think these aspects are, and I saw that, for example, in Finland, they joined the Ministry of Health and Ministry of Social Services into one ministry. And you get supports based on your needs, and doesn't matter if that need is medical or social. You have a need. You're a citizen, and you are valued by the public and by the country, and you need a need and you get help. And it shouldn't be a discussion, okay, where should that come from? So I think these are ideas we worth discussing and going deeper into. Okay, how can we organize our system of support, or the systems of support, in being really efficient in how they provide help?
Yeah, that's a great discussion to have. The cross-ministry challenges and the gaps fall right between those ministries. And it's interesting how, in BC we have somebody in the health system will write a letter of justification for a wheelchair, but it's the family and children, the Ministry for Family and Children, that is supplying that chair without any medical support. And they're able to deny those requests. And it's a real issue. Absolutely. We need to have a closer look at that and look to other jurisdictions, like I think you said it was Finland.
Yeah.
Interesting. Jennifer, we're getting close to wrapping up here. So if you want to speak into that a bit, and we'll,
I think for sure breaking down those silos. And I think when I saw the drawing that's happening, just, that classic picture of falling through the cracks. And I think we used to think about that happening more during transitions between pediatric and adult health services, but it's happening all the time throughout the life course of a child with disabilities and their families. And I think that idea of looking at the whole person, I know that my daughter Eleanor has about 24 medical diagnoses, and we have, some parts of the system that deal with autism, some that deal with intellectual disability, some that deal with the medical complexity, but there's nothing that really covers everything. And so we find ourselves falling through multiple cracks because we don't have a system that was built around this particular population. And I think Dr. Olaf mentioned at the outset about 20% of the population is disabled. And I think, with improved medical care, improved social care, we're seeing a larger group of children with disabilities growing and living into adulthood as well. And so, we don't want people stuck in those cracks in the system forever. And we need to start paving over and making sure they don't exist. And part of that is breaking down those silos and understanding that people are whole people. And it's not medical care over here, education over here, social care over here. There's a wholeness to that we need to address in our policies and our programs and in our funding models.
Absolutely agreed. Thank you both. There's so much expertise here, and there's so much we could talk about. I mean, there's big pieces. There's the care supports, there's the income supports, and then all the pieces we talked about today that people just don't see. So it's great to really have this conversation and try to bring it to light. And I hope that what happens from here, I really do hope that we can come together and that both of you will be a part of it and have some have an ongoing conversation and bring more people into it and see if we can make some good change. Thank you both so much for being here and for the work that you both do. Appreciated.
Thank you so much for having me.
All right.
Thank you.